Mount Sinai Hospital specializes in leadership, it has infrastructure, it has protocols, it has evaluation. These are the things that define centers of excellence. It's also characterized by great interprofessionalism, it's great geriatric leaders, and great partnerships with the community.
In 2010, Mount Sinai made a significant commitment by becoming the first academic health sciences center in Canada to make geriatrics a core strategic priority. That was really embedded in the ACE strategy that we founded at our hospital. It's got all of us around the table to think about how we can provide good quality care in different ways to meet the needs of an aging population. The ACE strategy really thinks about the continuum of care. Our patients often start in the community, they want to return there. We focus a lot of activities on what we can do at the community level to help people to stay healthy and independent. For those patients who come to our hospital in crisis, we've tried to think about what can we do in our emergency departments to recognize those older people at risk. For those who need inpatient care, we've developed a number of inpatient strategies that again try and recognize the unique needs of older adults in an acute care environment. And then from our outpatient work that we do, it's recognizing that some of our patients will require support in our outpatient settings so that we can get them back home and to stay in the community.
Acute Care for Elders, or ACE, is all about teams. It's all about how we collaborate as interprofessional team members, both within a hospital setting and how we collaborate with patients and families in terms of achieving the goals they set for themselves.
When a geriatric patient enters the emergency department, they're essentially at the entry point. Nurses are asking questions of the patient and their family about how they're able to care for themselves at home, how they're able to follow through with healthcare needs, and there you can identify if there's something that needs to be addressed.
We have the interprofessional team that we're working daily, collaboratively to mobilize our patients, etc. We have a very open communication station area. In the patient rooms, the floors are matted, and so that's really important to decrease risk for a patient falling. We have beds with the built-in exit alarms. We have whiteboards in our rooms. We have clocks with large fonts in the room, and that's to keep our patients orientated.
Mount Sinai Hospital and Geriatrics really value team-based care. We always provide a lot of feedback and work collaboratively with all our physicians as well as healthcare team members. Not only do we optimize medication use from order sets, we enhance communication and make sure that specialists and other allied health team members really get to the patients first.
There is some uniqueness in this, in the world of healthcare delivery in the acute care hospital. The capacity of the ACE program to have brought together all of the components, and in particular the psychiatric and mental health component, into a continuum of care for patients is unique and stands as a model.
Patients in hospital, when they're here a long time, lose a lot of the skills that they came in with, and our goal is to get them home. The MOVE program stands for Maximizing Aging Using Volunteer Engagement, and it's a program that began when the ACE unit was beginning to roll out. It's ways to target interventions from volunteers, engaging them in a number of different targeted activities at Mount Sinai.
A few years ago, we were very fortunate to be linked with Mount Sinai, and now through their ACE unit. We provide a broad basket of services to seniors in the community with the primary goal to help them to live at home. We have our house calls team, which is a home-based primary care team. About once a month, we have the benefit of having the geriatrician come with us on home visits. All these people use their skills to help the client or patient stay at home and thrive in their own home.
Patients who come to the hospital are getting the best geriatric care they can, and in a partnership with the CCAC, we're now doing earlier discharge planning with the CCAC involved with the ACE team so that we can get patients home as quickly as possible.
They took very good care of me. They were very attentive. They were very concerned about was I comfortable. The whole experience was a very positive one.
People are visiting Mount Sinai Hospital and are asking, how did you build this? What does it consist of? How do we make our program better? And that's a great compliment to us.
What has been absolutely remarkable is how quickly we've been realizing achievements to our ACE strategy just within a few years. Our lengths of stays have decreased significantly, and the quality of the care that we're actually providing is significantly greater. Our patients are being catheterized less, they're falling less, developing less pressure ulcers, and they're more likely to go home and less likely to be readmitted. The most fulfilling thing that we love about our strategy is we've been able to allow more older adults than ever before to remain healthy and independent where they want to be.